Assalamu alaikum. Today we are going to discuss another lecture of Trail Guide to the Body or the Palpation for Physical Therapists. We are going to discuss the head and neck and face. We'll start with the topographic anatomy or topographic views. In this picture, we are looking at the structures in the head and neck region. This is the region that is called as the temporalis region or the temporal region, the muscle here being called the temporalis. Then you can see this region is for the masseter. This region is called the glabella. This is called the nasal ala, the philtrum. Similarly, the corner of the mouth. Then you can see the mandible, the base of the mandibular angle, and the upper trapezius, sternocleidomastoid. In front, the hyoid bone and thyroid cartilage, and similarly the jugular notch, which we discussed in the previous lecture as well. Now this is really very important slide because this shows you the triangles of the neck. There are two triangles that are made in the neck region, the bigger triangles. So one is called as the anterior triangle, which is shown over here, and the other is called as the posterior triangle, which is shown over here. So the boundaries of the anterior triangle are the sternocleidomastoid, the base of the mandible, and on the front the trachea in the midline. The posterior triangle boundaries are the clavicle, which forms the base, the upper trapezius, and the sternocleidomastoid muscle. Now this is posterior triangle is really very important clinically because the brachial plexus and the external jugular vein, it passes through this triangle or through this region. So just remember that this is the space between the sternocleidomastoid and the upper trapezius. If you try to explore the skin and fascia, you will see that there is a difference of mobility in craniocaudal direction and in horizontal direction from right to left. The skin in the neck region is thin as compared to the skin on the forehead, and the skin on the forehead is more thicker as compared to the skin in the neck. If we discuss the bones and the bony landmarks of head, neck, and face, these are 14 bones. Together they are called as the facial bones or the 14 bones that make up the face. They are the nasal bones, especially the inferior nasal concus. There are two. The lacrimal bones, there are two. Mandible, two. The mandible is just one bone, but if you divide it in the midline, then you can say, but there is no description in the anatomy books like right or left, but it is just single bone. So mandible 1, maxilla 2, nasal bones are 2, palatine 2, vomer is single bone that separates the nasal sides, and then the zygomatic bones, one on each side. So this is the bone that makes the prominence of the cheeks, and there are a lot of bones that together make the orbital cavity. Then from the posterior view, we can see the sutures of the skull, as well as we can see the mandible, the teeth, the maxilla, the temporal bone bearing the mastoid process. We can see there are nuchal lines. One is called the superior nuchal line, and there is another inferior nuchal line. Whereas in the midline, there is this protuberance that is called as external occipital protuberance, and this is the occipital bone. These are the parietal bones. In between the parietal bones, you can see the sagittal suture. Between the parietal and occipital, you can see the lambdoid suture, and this point is called as the lambda. Now, because This hole is called as the skull, and this is called the cranial cavity or the cranial vault. So you can see a lot of bones making this cranial vault. For example, this region is called the occiput or occipital region because uh, this bone is called occiput, so this is the reason it is called the occipital region. And then you can start to find the external occipital protuberance in this region. That's a very prominent bony landmark in the structure, and it lies in the midline. Then you can feel the parietal bones. So the two sides on right and left, you can feel the parietal bones making the posterior and superior part of the skull. Then you can see the temporal bones. The temporal bones are the bones that are just underneath the ears. So the temporal bones, and this is the facial foramen. Then you can see the frontal bone. So just making the forehead, or if you try to touch your forehead, then you are on the frontal bones. The sphenoid bones are just anterior to this temporal bone, and it is posterior to the zygomatic bone. So this is just some part of the sphenoid. So it is a butterfly shaped bone. It has two wings. One is called the greater wing and one is called the lesser wing of the sphenoid. Then you can see the nasal bone and the maxilla. Now if you look at this bone, the jawbone or the mandible, so the mandible has a body, a base on the underside, and then it has submandibular fossa which is on the inner side, the mandibular angle, the ramus. Then it has two processes. One is called as the coronoid process, which is very similar to the radial head. It also has a coronoid process. The and then the condyle is over here. In this picture, we are looking at how to palpate the external occipital protuberance. The external occipital protuberance is the midline bony prominence that can be felt in almost everybody. So if you try to find the external occipital protuberance, there are many ways. The partner needs to be in prone lying, and you can slide your hand and try to find the most prominent part of the bone, and there you will find the external protuberance, external occipital protuberance. Now this is superior to the nuchal ligament as well. So if you find the nuchal ligament, or if you run your fingers from the spinous processes of the cervical vertebra and then you run all the way up in the midline, you will find this external occipital protuberance in the occipital region, and just lateral to that you will find the superior nuchal line. And if you try to find the mastoid process, there are a lot of ways, but if you just move your fingers just lateral to it behind the earlobe, and then you'll find the mastoid process. The parietal bones together, they join by the sagittal suture in the midline, and then there is the frontoparietal suture as well. Here you can see the parietal bone makes the most superior and lateral part of the skull, so it is really very easy to find out where it is. The temporal bone has the mastoid process, the styloid process, and the zygomaticus arch. So the mastoid process is the site of attachment for the sternocleidomastoid, and it is very prominent. If you run your fingers, this is the region of the upper trapezius. The upper trapezius fibers, they attach till this point, and then there is the sternocleidomastoid. Then the styloid process, which is very sleek and small, but it is just anterior and inner side to this mastoid process. And then we have zygomatic arch. So it is made, part of it is made by this temporal bone. So if you want to find out where the zygomatic arch lies, So you just run your fingers uh, on the most prominent part of the cheek and then run posteriorly towards the uh, ear, so you'll find the zygomatic arch. This is just one way of finding the mastoid process. The partner can be in supine lying, and you can also ask them to rotate their head a bit to about 30 to 45 degrees. That makes it a lot easier to palpate, and it makes the sternocleidomastoid prominent as well, so it becomes really very easy. And then how he is trying to pinch this mastoid zygomatic arch, and this is really very interesting and really very easy, because just anterior to the ear you will find the zygomatic arch. Then the mandible has body, base, submandibular fossa, angle, ramus, condyles, and coronoid process. Uh, there is a key to finding all these. So the body can be felt anywhere. When you try to hold somebody's face, when there's a fight and when somebody is in anger, they try to grab their face, so they most probably grab from this side, and that is the point where it is called the body of the mandible. Then the base of the mandible is just the underneath or the lower portion of the mandible that makes the base, and it is again very prominent. Just by looking at a person you can find out where the base or the angle is. And submandibular fossa lies deep, so there are ways to find it. So one way is either you can find it from the inside or from the outside. uh, the outer approach is far much convenient. Then the ramus is again very prominent, and it is a very large part, so it is also very palpable. The condyles and coronoid processes, uh, they are very palpable, but with dynamic activity. So if you ask your partner or your patient to try to open the mouth and close the mouth, so with every opening and closing you can find the moving coronoid process and the condyle. So the condyle moves a lot, and this makes a condylar joint, the TMJ. There is a disc in between the condyles and the other part of the cranium, so making the temporomandibular joint. So there is a temporal fossa where the mandibular condyle it gets attached. So as I was discussing, there is an articular disc, and when there is this jaw opening, there are a lot of mechanics. But the first thing is that the the, the mandible needs to drop first. So it drops down and then it slides a bit anterior, and then it drops down, then it slides anterior, and then it drops. So this is a continuous process till you reach your final uh, mouth opening limit. So here you can see the condyle in place in the temporal region, that making the temporomandibular joint. And it is really very surprising to know that this is the most frequently used joint in the body, and a normal person uses about 2000 to 3000 times a single day. So here you can see from the temporal fossa it's coming out all the way anterior, and when the mouth is fully opened it is out of this temporal fossa. So again the disc, it makes very important role or contribution to the overall biomechanics of this joint. And clinically this is one of the least commonly affected joint, but if somebody comes to you it becomes a real hurdle to treat them. And there are only a few techniques that can be applied to the patient to treat this condition. One of them is called the temporomandibular joint manipulation, that resembles the cervical manipulation. Here you can see the therapist is trying to palpate the angle of the mandible. This is the point just anterior to the ear where you try to palpate this temporomandibular joint, and the partner is trying to open and close the mouth again and again. So if somebody tries to clench their teeth, with force, you can also see the prominence over here, and that tells you where this TMJ lies. Then the fully open mouth makes it a lot easier to palpate the coronoid process of the mandible. The trachea, it lies in the midline, and it is also called as the windpipe. Here you can see this the hyoid bone, the thyroid cartilage, the cricothyroid cartilage or cricoid cartilage, then the thyroid gland and the trachea itself. So in the midline, when the partner is supine, you can easily palpate the windpipe or the trachea, and the hyoid bone is also palpable, and this is the first palpable bone just underneath the mandible, and you can say at the base of the mandible you will find this bone just proximal to or just inferior to the angle of the mandible. You will find this bone, the hyoid bone, and then there is the soft tissue between the hyoid and thyroid, and then you will find the thyroid, and this region is also called as the Adam's apple. So here you can see the therapist is trying to find out the trachea or the thyroid cartilage itself, then the cricoid cartilage, and then the trachea. So in the midline, you can find it very easily, and you can make your partner to swallow something, and then you'll see that how the thyroid cartilage, it moves all the way up, receives that thing, and then comes down. So that makes the act of swallowing. And there's this really very interesting tale about this Adam's apple, and this is a basically bibliographical tale that tells us that when the Adam took the first bite of the apple, which was the forbidden fruit according to the Bible, it got stuck in his neck, and that is the reason when it got stuck, it made his neck swollen, and that is the reason it is called as that this is the Adam's apple. It shows that the Adam has eaten apple, and then this trait was, moved to his male descendants, and it was a very prominent feature in the males. So hyoid bone is a very small bone, but it's a very important bone because there are a lot of muscles that get attached to the hyoid bone, and it has a greater horn, a lesser horn, and a body. So here you can see the greater horn, the lesser horn, and the body. The hyoid bone is the first most bone in the midline that is palpable just beneath the mandible. I told you before that if you ask your partner or your patient to swallow something, whole of this, you know, whole of the structure, it goes up and then it goes down, or up and down with every swallowing. Or if there is an attempt to swallow, you will see the movement. So it keeps on moving up and down. If you talk about the muscles of the head, neck, and face, definitely there are a lot of muscles, but these muscles are very easy to remember, and these muscles are very small muscles. So we'll try to discuss these muscles and their function in just a detail. So first of all, here you can see this muscle is called as the Occipitofrontalis muscle. This muscle runs all the way from the occipit till the frontal region, and this is the muscle that makes you raise your forehead to produce the horizontal wrinkles. And then you can see the temporalis muscle being the largest muscle over here, then the sternocleidomastoid. All these muscles are associated. There are a lot of muscles. They're called as the hyoid muscles because they somehow get attached to the hyoid bone. So there are the sternohyoid, the omohyoid, the genohyoid, the sternothyroid, and digastric muscles, and so other muscles. And then we have muscles of mastication and the muscles of facial expression. So we will try to isolate all these muscles or the muscle groups. Here you can see there are a lot of muscles, the mylohyoid, then the digastric, it has the two bellies, anterior belly and the posterior belly. Then there are a lot of muscles that are cut, but they are shown over here. You can see the sternohyoid, Then omohyoid, it has again two bellies, the superior belly as well as the inferior belly, and sternothyroid, sternohyoid. So these are the muscles that get attached to the hyoid bone and the sternal bone. Now there are a lot of muscles that work together to produce a single movement. For example, for the flexion, sternocleidomastoid, anterior scaleni, the longus capitis and longus colli, collectively they work together to produce a movement of flexion. For extension, there are a lot of muscles because this is an act against gravity. So that is the reason we need a lot of muscles. The main role played by the trapezius, especially the upper fibers, then the levator scapulae, the splenius capitis, splenius cervicus, rectus capitis, superior, posterior, major and minor, then oblique capitis superior, semispinalis, longissimus capitis, longissimus cervicus, iliocostalis cervicus, multifidus, rotators, intertransversi and interspinalis. So all these muscles from this region or from these region, these are the muscles that we discussed in the spine before. So bilaterally, if they work, they can produce extension because these are the long muscles, and some are the small muscles as well, like the multifidus and the rotators. So again, and even these interspinalis and intertransversi are very small muscles. So these are together, if they work on each side like bilaterally, they can produce extension. So these muscles are working together to produce rotation. So if the muscles on one side they work, for example the extensors on one side they work, they will produce somewhat a movement called as rotation. So the flexors on one side and extensor on the other side, they can also produce the same movement, that is called the rotation. For rotation, we can see the levator scapulae if unilaterally to the same side. Levator scapulae, splenius capitis, splenius cervicus, rectus capitis, longus colli, and all these muscles. For unilaterally to the opposite side rotation, we have trapezius, sternocleidomastoid, anterior scaleni, middle and posterior scaleni, multifidus, and rotators. So this is the movement of side bending. Here you can see this is the posterior view and this is the anterior view. So a lot of muscles in the posterior region they are working as well as in the anterior region. You can see the this muscle is the levator scapulae, and then the scaleni muscles are working together along with this levator scapulae to assist the neck into the flexion. Whereas here you can see the sternocleidomastoid, it's a very major muscle again, and then these muscles are all the muscles, these are collectively called the neck side benders, but the scaleni muscles and some part of other muscles as well. So for lateral flexion, the trapezius, levator scapulae, sternocleidomastoid, these are the major muscles, but the anterior scaleni, middle and posterior scaleni are the muscles that assist. Splenius capitis, splenius cervicus, longus capitis, all these muscles they're also assisting the side bending. Now these are the muscles that bring the mandible into elevation, or they help you close your mouth. So these are the masseter, the temporalis, and the medial pterygoid. So there are three muscles that work together for the movement of elevation. For the depression, there are muscles like geniohyoid, mylohyoid, the stylohyoid, digastric muscle. So all these muscles they work together to bring your mouth down. These are two movements called the protraction and the retraction. The protraction is the movement of the mandible anterior to the lips or towards the anterior side, or the retraction is pulling the mandible towards the posterior side. So protractors are the lateral and medial pterygoids, and the masseter as well, but the retraction is done by the temporalis and the digastric muscle only. Sternocleidomastoid, it has two fibers, the sternal fibers and the clavicular fibers. So sternocleidomastoid from the sternum towards the mastoid process. If you ask your partner to lie in the supine lying and then you ask them to rotate their head to about 45 degrees and then you can resist the cervical flexion, the sternocleidomastoid becomes very prominent. So you can find the sternal fibers on the anterior side and the clavicular fibers on the posterior side, but they will merge towards the mastoid process. Here you can see, and then you can also differentiate the sternal between the sternal fibers and the clavicular fibers. The therapist is trying to find out the sternocleidomastoid, both fibers. The scaleni muscles, they are a bit deeper muscles, and I told you in the earlier lecture as well that there is this transverse process, and anterior to the transverse process is a process called as anterior median prominence, and then there is a posterior prominence that is a site of attachment for the posterior scaleni. So this is the tubercle, anterior median tubercle and posterior median tubercle. That is the site of attachment for the anterior scaleni and the posterior scaleni, and then on the midline, the middle scaleni are attached. Now you need to pay attention to this slide because this slide is really very important for you guys if you are a physical therapist or any healthcare professional who deals with the thoracic outlet syndrome or the brachial plexus nerve injury as well. So you can see that this is the site where the brachial plexus lies, and there is the subclavian artery and the subclavian vein, and this is the site where I'm trying to move my cursor. So this is the site where your clavicle is. So here you can see the clavicle is cut, so the clavicle goes all the way to this because it is an S-shaped bone, so it goes all the way up and over here. So there is sometimes costoclavicular compression of these structures. If the scaleni muscles they become taut and tight, it can really affect these structures, especially the neurovascular bundle, the subclavian artery, and the brachial plexus. So there are chances that just because of these three little muscles, a person's whole upper extremities function can be disturbed. So you need to stretch and learn to stretch the anterior, middle, and posterior scaleni, and it's just a bit of angulation that is required. Now you can see this is another schematic trying to show you the importance of these muscles. You can see the second rib, the first rib being the most shortest rib of all, and it is most curved rib, and then you can see the close association of first rib with the clavicle. And here you can see the levator scapula, the posterior scalene, the middle scalene, and the anterior scalene. So it just, if this muscle is tight or these muscles are tight, they tend to pull the first rib upward, and then they create a compression between the clavicle and the rib. Hence the name is costoclavicular compression. Now in this picture, the therapist is trying to find out the scalene muscles, especially if you run your fingers from the sternocleidomastoid all the way back, you will find the omohyoid muscle, and deep to the omohyoid muscle you will find the scaleni muscles. So again, anterior to the upper trapezius, you will find the scalene muscles. Then the masseter muscles, you can see the superficial and the deep valley of the masseter muscle. The masseter muscle is also the muscle, one of the muscle of mastication, and it is at the side of the angle of the mandible. So you can ask your partner to lie supine and clench their jaw, and then you can feel the tensing muscle. This muscle will be masseter, and when they stop clenching, this will be relaxed. So hence it is more confirmed that this is masseter, and you can clearly find out the masseter at the angle of the mandible. Then the temporalis muscle lies in the temporal region. So just beneath the ear, you will find the temporal region or the temporalis muscle. This is a very massive muscle, and it becomes very prominent when you try to clench again the jaw. Here the therapist is trying to find out the insertion of the temporalis, and this is towards the coronoid process of the mandible, and with maximal opening of the mouth you can try to find out the coronoid process just beneath the maxillary process. This muscle is called the platysma muscle. The platysma muscle is present in almost everybody, so there is no variation between us, but a few of us can really work with this muscle very well, and we can also produce this the contraction of these muscles. This muscle um, is present in animals' skin throughout their skin because they are able to move or shake their skin. But in the human beings, it is present only in the neck region or in the cervical region and on the anterior side. So when you try to depress your angles of mouth bilaterally, you will feel your platysma working. Then this is Occipitofrontalis muscle. The Occipitofrontalis muscle is the largest muscle of this region, and it starts from the occipital region and runs all the way to the frontal region. People say it has two bellies, the occipital belly and the frontal belly, one on each side. So here you can see the muscles, the frontal portion of the occipitofrontal muscle, and it produces the horizontal wrinkles on the forehead. If you want to palpate the occipital belly of the occipitofrontalis muscle, you can ask your partner to lie supine and rotate their head, and then try to raise their forehead and press against your hand, and in this region you can find the muscle contracting. Then the medial and lateral pterygoid, these muscles are in the deeper or inner side of the mandible, and you can also see the zygomatic arch that is cut down to show you the lateral and medial pterygoid. The longus capitis and longus colli are again the deep muscles, and this is an anterior view that shows you. So this is virtually impossible to palpate these muscles because first of all they are very deep, and secondly there are vascular structures that passes through this region, and being the jugular vein. Carotid artery is also over here, so the carotid artery, it also makes it very difficult to palpate these muscles, and these small muscles, longus colli. Then the muscles of facial expressions, although these muscles look a lot, but these are not very large group of muscles. This is a small group of muscles, and their names, it makes them a lot easier to remember. The frontal muscle, the part of the occipitofrontalis muscle, the frontal portion, it makes horizontal wrinkles, and it is the muscle that is on the forehead. Now in between the eyes you can see the muscle that is called as procerus, and then you have this muscle which is a very small muscle that is called the corrugator supercilii muscle, and it makes you elevate your eyebrows. Then you have orbicularis. So orbicularis muscles are those muscles which are in a circular motion or in a circular form. So we have orbicularis oculi as well as we have orbicularis oris. And the function of these muscles, they act as a sphincter. So when these muscles they work, they help you close your eyes forcefully. Then you can see you have auricularis muscle, which has anterior, superior, and inferior part as well. So this muscle is responsible for moving your ear. Some people can make use of this muscle very easily. Then you have levator palpebrae superioris. This is called a levator palpebrae for the eyebrow. Levator palpebrae superioris is the muscle that help you open your eye. So the eyelid is moved by this levator palpebrae superioris, and then we have levator labii superioris muscle that elevates the angle of the mouth. Then we have zygomaticus major and minor. These are the blowing muscles. They help you to blow something. And again, there are muscles. The muscle is orbicularis oris. This muscle is the depressor labii inferioris, and the mentalis muscle. This produces some some spots in this mental region. So again, all the muscles that we discussed are shown over here, but from the different view. The buccinator muscle, it is a muscle that help you press your cheek against your teeth. So when you try to blow, your buccinator muscle is working a lot, but there are other muscles that help the buccinator as well. Then the depressor anguli oris, it helps you to depress both angles of your mouth or corners of your lips downward. Then the depressor labii inferioris, this is the muscle that help you bring your lower lip down, and this is again working on the both sides. Levator anguli oris, so these are the muscles that help you elevate the angles of the mouth or the angle of the lip together upward. Then you can see the levator labii superioris. If it works on one side, it can make you show this expression, and together you can also elevate your lips. Mentalis is the muscle. This is a muscle that makes a stronger contraction, and it creates a dimple in this mental region, and this is a very small muscle responsible for making this dimple. Then the orbicularis oris, as I mentioned earlier, that there are a lot of muscles that assist the buccinator, because the buccinator alone cannot help you to retain, let's say, air in your mouth, and you cannot try to blow if your orbicularis oris is not working. So it makes your lips work in a fashion that is similar when you are trying to breathe with pursed lips. So approximation of the lips, and when you're trying to blow something, when you're trying to blow a candle, so it is very similar to pouting. Then these are the muscles that are responsible for these expressions. Together they're called as the muscles of facial expression. There are a lot of expressions like anger, contempt, disgust, fear, happiness, sadness, and surprise. This platysma muscle, as I discussed previously, that it makes your skin move. So this is the only muscle that present in the human in this region that can help you move your skin. Apart from this region, we are not able to move our skin. So here is a very famous character from the movie called The Creature from the Black Lagoon, and it has this platysma all over his body, and hence it was possible for him to move the skin. This small muscle, the risorius muscle, it helps you smile, and it pulls the corner of the lips. Zygomaticus major, it is also a smiling muscle, so it can help you smile. Zygomaticus minor, it also make you look a bit joyous, but not as much as Zygomaticus major. The muscles of the nasal region, they help you create these wrinkles around the nose and elevate the angles of the nose. So these are the muscles called the levator, labii superioris, elite nasi, one on each side. Then the nasalis muscle, these muscles are responsible for creating the wrinkles over the nose and opening the airways or opening the ala of the nose. Then the procerus, this muscle make you produce again the horizontal wrinkle but between the eyes. This is the function of corrugator supercilii. You can make this face, or you can create the frown lines, the vertical wrinkles between the eyes. Orbicularis oris and orbicularis oculi, the two muscles. The oris is around the mouth and the oculi is around the eyes. Then the muscles of the scalp, again the occipitofrontalis. Some people have the ability to move their hairs with the contractions of the occipital and frontal muscles. And this is the unilateral raising of eyebrow. This is because of the frontal muscle. Together working, they can elevate both of your eyebrows, but if it is working on the one side, then it can be this expression. So this is the reference book. Now we'll have question and answer session. Thank you very much.